You've likely heard of chloroquine or hydroxychloroquine. It's an anti-malaria drug with potential as a coronavirus treatment. It is being tested in Boston right now, but there isn't much evidence yet. So today I spoke with Dr. Jeffrey Sparks. He's a rheumatologist at Brigham and Women's Hospital about what it actually does. He prescribes hydroxychloroquine to his patients with chronic conditions, things like lupus, rheumatoid arthritis. He says we don't know yet if it works as a coronavirus treatment.
I think there's a notion that this hydroxychloroquine could be a cure. Again, I don't know what will happen or what will transpire, but we certainly know that there's patients who have been on hydroxychloroquine chronically who have come down with infections. And certainly there are patients who have been treated with hydroxychloroquine and have had poor outcomes. So it is, while this may help, it may not be the cure and the miracle that we're all hoping for.
So some have said they are considering taking hydroxychloroquine as a preventive measure. But if you don't need it, if you're not diagnosed, is that safe?
From a short-term perspective, there can be rare, serious rashes, some of which require hospitalizations. There can also be anaphylaxis. And then importantly for COVID, it might cause conduction abnormalities in the heart, and a very small proportion could actually have arrhythmias and even present with sudden death. Obviously, this is an uncommon side effect, but if you're talking about using this in the general population with many millions of people, certainly there will be some patients that experience these very rare but serious and even deadly side effects.
So it might be an acceptable risk if someone is in critical condition with COVID-19 with no treatment options. Now, the other concern for Dr. Sparks is that if too many healthy people start taking hydroxychloroquine to prevent COVID-19, there may not be enough supply left to treat the patients who really need it.